Now, over 80% of South Africans with visual impairments live in rural communities. In most cases, these impairments are completely treatable, but access to specialist diagnosis and treatment in these rural areas, it's extremely limited. This is why the Tshemba Foundation is kickstarting a blindness prevention program. The non-profit is calling on ophthalmologists and optometrists to volunteer through their organization to help give sight back to rural South Africa. Let's find out more from Medical Director at Tshemba Foundation, Professor John Gear. Thank you so much, John, for joining us this evening. Of course, you know, access to eye care in rural communities in South Africa, it's not a new issue, is it? But let's first start with, you know, this initiative that you are embarking on and why it's so important.
Thanks so much for inviting me, and greetings to your viewers. I think the important thing to emphasize just first of all is in your introduction, you said 80% of South Africans with visual impairment live in rural areas. I think that's not quite true. I think 80% of the untreated eye conditions are to be found in rural areas, and that's a somewhat different statistic, but still a critically important one, and one that leads to us as Tshemba to prioritize targeting visual abnormalities, visual challenges as a health priority in that area.
Now, from your experience, John, you know, would you say that, you know, a major part of this problem is because of our ailing health system and the clinics in the rural areas that just don't have the proper tools to deal with the situation?
Yeah, thanks. I think it's a very complex situation, and it's very easy to blame the health service, to blame the health professionals, but the whole social fabric in rural areas is hugely challenged across economics, education, infrastructure, and then healthcare per se. And each of these plays into that complex web of vision loss. So if we look just at one example of the story, if there is someone in a rural area who is suffering from visual impairment, their ability to access healthcare is not just about, is there a clinic nearby? Does that clinic actually have eye care expertise? It's also about, well, who's going to take me to the clinic? Am I going to miss school? Am I an elderly person who perhaps is unable to walk unassisted or travel unassisted? That means I need to pull a grandchild out of school to go with me. So it is complex, and I think it is for one of the reasons that we are trying to sort of activate an awareness. And our approach is really two-dimensional. It's not only just recruiting the specialist volunteers to come and care for people with eye problems, but it's to actually get out there and identify people with the eye problem and then get them to the right source of care.
You know, vision impairment is a challenge for any person, but for somebody living in a rural area, it's much more of a handicap than it is maybe for you know, someone who doesn't live in a rural area. Would you say that, you know, for example, if you are the breadwinner of your family in a rural area, this is just so much more of a bigger problem, especially kids also having to learn? That might be a stumbling block for them as well, having to go forward.
Yeah, I think that's absolutely right. And let's look at the kids first of all. Education is one of the most important and critical factors in this country. Our whole education system is under huge duress. The quality of the classrooms, the quality of the teaching, not necessarily because teachers are uncommitted, but because of size of classes, because kids who do have learning difficulties are often in mainstream schooling. And then if you've got a child with visual impairment, that child is not necessarily aware of their visual impairment and therefore doesn't sort of identify themselves as struggling to see the board, the whiteboard, or listen if the school is privileged enough to have PowerPoint presentation, to be able to read a PowerPoint slide. But many schools do not have these sort of facilities. So one of the important ideas that we have is to actually start screening for visual impairment in the schools so that we can identify those kids earlier and get them to appropriate care. And often appropriate care is something as simple as anti-allergy eye drops. One of the major problems is kids get significant allergic conjunctivitis. And then the other one is just simple short-sightedness, and merely putting a pair of spectacles on that child that are suitable for their visual impairment changes that child's life forever, and potentially the family, the earning capacity in the future.
Yeah, because it could have a huge ripple effect in communities if it's not being dealt with. Now, what would you say are some of the major contributions to visual impairments, especially in these communities?
I think perhaps the most important is allergic conjunctivitis because it is so common. And if it's not properly treated, strangely and surprisingly, even to a physician like me who doesn't know a great deal about eyes, if you've got allergic conjunctivitis, you start rubbing your eyes. When you start to rub your eyes, you then start to do damage to the eyeball. And in doing that damage, you distort the eyeball. You may then start distorting the lens. The child may get double vision. There may be scarring. And before you know where you are, merely from rubbing your eyes, and I'm not saying this happens over a week, this happens continuously over months of recurring allergy, that child will start to lose sight in that eye. And so just treating allergic conjunctivitis is a key factor. Other factors that are important in the school situation are short-sightedness, and that often, as I said, is correctable. More importantly, perhaps in the adult population, conditions like glaucoma, which is high pressure in the eye, which is a silent, let's say, silent cause of blindness, because the pressure damages the internal structures of the eye, and before one knows where one is, the eye starts to lose acuity, and gradually blindness comes forward. Another important one is diabetes. Many people in South Africa, and more people, are suffering from diabetes, which is a lifestyle disease to a large extent. It's also an inherited disease, but diabetes immediately predisposes to vascular damage in the eye. And that again, over time, if the diabetes is not properly controlled, those patients will gradually have loss of eyesight and will go blind. So conditions like glaucoma, like diabetes, like allergic conjunctivitis are critical damages and precursors to the loss of sight.
Now, of course, you are busy recruiting people to help you in this program as well, of course, optometrists, ophthalmologists, but also, are you also looking for other volunteers, and why should people volunteer?
Look, I think volunteering is perhaps a glorified sort of role that privileged people like to enjoy and take on in their lives. I'm not sure that that's how we should be looking at volunteering. We actually cynically talk of volunteerism, with people who do have a medical qualification or a healthcare qualification come to exotic parts of the world, really as much to benefit themselves. We are very strong on, we are looking for humanitarian volunteers who are motivated by passion and care for their fellow human beings. And those are the sort of volunteers we want to recruit. And we recruit them across the spectrum, not just eyes and not just ophthalmologists and optometrists, but we're recruiting specialists and generalists. And where we work, it's a primary healthcare hospital, the district hospital, Tinswalo, and we recruit people who are multi-skilled, who can function in a casualty and emergency section, who can function in an obstetrics and gynae environment. And obviously, to make the most of those volunteers, particularly if they're international volunteers, they go through a complex registration saga, which is a deterrent, but in a way helps us weed out those whose motives may not be pure. And we get extraordinarily competent people volunteering. We get a lot of South Africans. Our South Africans immediately adapt to volunteering at our hospital. And a South African coming for 2 weeks without sounding unkind to our international volunteers, is as valuable as an international volunteer coming for 4 weeks, because they do take time. So for our international volunteers, we actually encourage a 3 to 6 month volunteering period, and our local volunteers, particularly if they've been before, and even the international volunteers who've been before, we then welcome them back, even if it's for shorter periods.
And you know, speaking of volunteers from elsewhere in the world, do you find that you do get a lot of international volunteers? And from what parts of the world are they mostly from?
We've been extraordinarily fortunate. I think it's fair to say that the majority of our international volunteers are from Europe or from the UK. I distinguish those because of the horrors of Brexit, if you believe in the horrors of Brexit. But then we've had volunteers from Canada, from the USA, from the South Americas, from Africa, from the Middle East, from further east than that, and as far east as New Zealand and Australia. So it's a pretty international mix, but small numbers from some of those more far-flung countries.
Let's talk about, you know, the cataract surgeries that you've performed. How successful has those been?
Okay, so one of the key starts to before we got into this eye prevention, this blindness prevention, was actually merely trying to correct existing blindness. And cataracts are a massive cause of existing blindness in the elderly, and as such, also have a massive social impact. The social impact of a grandmom staying at home who's blind means that her grandchild stays at home, and that grandchild is then missing school. So we saw this as our primary priority. It's also a quick fix in a way. A patient is diagnosed with cataracts, they come in, they are assessed to make sure that there's no contraindication to the surgery, and immediately thereafter they receive a cataract operation, which is literally sight restoration overnight. One of our earliest and most moving stories was of the grandmother who had her cataract. She was brought in by her 10-year-old grandson, who she'd never seen before in her life because of her blindness.
Wow.
The next morning, she saw him face to face. It's a powerful, powerful change of life. And that is rewarding for the doctors, it's rewarding for our staff, and it's particularly rewarding, obviously, for the patients, the family, and their communities. And we've done a lot of cataract surgery now, about 700 operations so far, and very active. And sadly, COVID took, during that period, our cataract interventions took a hell of a knock. And more recently, with the social upheaval around the healthcare protests around salaries and conditions of service, without passing any judgment on the striking community and the protest community, that has compromised our ability to offer cataract care as well. But insofar as we can, we run a clinic once or twice a month, and so that means we average between 10 and 15, 18 clinics a year, and are able to do anywhere between 20 and 40 patients per clinic.
And what parts of the country do you try and go to offer these services? Is it specific regions, or is it across the whole country, each province, or specific provinces?
Look, I've always believed in you start small and you roll out. We started, I think, appropriately small. We only function in the Bushbuck-Ridge area, which for those of you who know your geography, I don't need to give you the lesson, but for those who don't, it's the area overlooking the Kruger National Park. And it is made up of two major language groups, Sepedi and the Tsonga-speaking people, the Shangans. And we work in both those communities, but based out of Tinswalo Hospital. We have expanded somewhat into the clinics, the surrounding clinics. We do a little bit with the not-for-profits in the Limpopo province, but in general, our field of activity at the moment is the Mpumalanga Department of Health Northern section. Beyond that, though, collaboration, encouragement, participation, and partnership with other healthcare organizations does allow us to have some influence and encourage ideas elsewhere in the country. But at the moment, it's restricted to that Bushbuckridge area.
Thank you so much. That's Tshemba Foundation physician and medical director. Thank you so much, John, for joining us this evening. I really appreciate that. Of course, you know, the big issue, one of the big issues that the country has in rural areas is access to eye care. And thank you, John, for sharing some light on that. Still to come.